So I think two areas that I'm very interested in. I think more and more people have understood the importance of getting the patient voice. Getting the patient voice from the very beginning in the research question. We've been answering a lot of questions that nobody's asking, or at least the most important person, the patient, is not asking. So getting that patient voice early on, getting that engagement, using these different tools to get that engagement, using patient-reported outcomes for decisions, regulatory decisions, research studies, treatment decisions. So including that information and being able to include it. So I think we've got glimmers of it, but we don't yet necessarily have useful tools that will work in the work stream. And again, we don't have that interoperability, so if we're collecting the data, we have a lot of apps out there, but the app doesn't necessarily collect with the electronic health data or the other data collection that we have. And honestly, I think we have a lot of noise, so I don't know that we need more tools. I think we need to figure out what are the better ones, what are the ones that work best, maybe focus in on that. You can get a lot of data. You talk to doctors, they actually don't like getting the data from apps from their patients because it's a huge amount of noise. You know, we want the signal, we want the important things. So I think a better filtering or a better linkage of what's the important things that we need to collect, and then making it much easier to do.
And I think that's going to come from artificial intelligence, machine learning, and very, very smart software programmers. Ultimately, that's going to change the way we can handle this enormous data. If you think of it as a building that's on fire because this data just keeps coming down, you've got to do something to improve outcomes. I think you're going to have your electronic medical record on your iPhone. I think in the next decade, you're going to have your full genetic code on your iPhone or on your Samsung or whatever your smartphone or tablet is. You're going to go to the doctor, you're going to see me, and instead of me giving you a drug, I'm going to give you the drug or the device that works for you based on your genetic code. I think data and useful collaboration using data between industry, between doctors, between hospital administrators, and between government is what's going to change the way we perform healthcare. We're going to focus less on treatment and more on prevention. Then lives will be saved, dollars will be saved, and outcomes will improve.
There needs to be an investment in infrastructure. I mean, some of this very fragmented, in every level, healthcare is fragmented, and one of those important levels, as we've been talking about, are in all the different tools used to collect data, store data, and what to do with that data. So there needs to be, I think we have the resources, but we don't have the infrastructure linking them. So I think investing in that infrastructure, taking even what you already have, you know, say in your hospital, in your hospital system, and figuring out how can you leverage what you already have with some infrastructure to start building this. You know, it's not sexy, but I think it's necessary. We don't need another tool out there, we need a better way to link these tools.
Engage on social media. Every CEO should have a Twitter account. Every hospital administrator should have a Twitter account. Start by listening. Start by figuring out who the thought leaders are. Follow those thought leaders, then start engaging. And then you can figure out what the hot spots are, how you can improve your systems, how you can improve care for your patients.